Okay, in this video we're going to go over how to do an initial evaluation. I'll try to keep this as fluid as possible. It is just a little bit, can be a little bit of a learning curve to get used to the evaluations, but if you just follow along, kind of review this video maybe a couple of times and practice it, then it becomes pretty obvious where you need to click through. So we went over before the couple different ways that you can get to an initial evaluation. Let's say that this one has been checked in. Again, you can get to it through get back out of there. You can go home to your dashboard, and then you could click on your not started or late notes. I have a couple here, but they're not, so I can't click in there. But we'll come back to the schedule and open it up this way. So I'm just going to right click, go to documentation. You can click on either SOAT Notes exam or flow sheet. I tend to just do flow sheet. So again, all of your initial evaluations will have a daily note attached to it. So you do have to still do this section because this is what's going to generate the charges. So if you're trying to do your initial evaluation while you're with the patient, then you may want to skip this section and go right over to the notes section. We'll talk about that in a second. I tend to just write my subjective info down and jot some notes on a paper and do the evaluation after, but I have therapists that do it while the patient's right with them as well. So you go through this the same way as you do a daily note. You write, you can just copy and paste this because you don't have, this note is tied to the eval again, so there's no need to write more in here. You hit save. Let's say I did some manual therapy with them on that first visit. I click the box that it's going to generate that charge. I come down here, click on, let's say this is a high complexity. I'm going to add my minutes. You could verify that your charges are correct after you save it. Hopefully that'll generate charges. It might not appropriately do it. Yeah, it does. So we've got your manual codes here. You've got your evaluation code here. So the way that I think about the rest of it, because this daily note's the same as you do everything else, is that I try to go right to left on the screen. I'll come over here, make sure I have my time in and time out. The next thing up here, because there's a lot of buttons that you can click, most of them are not necessary. The first one that you come to that you need to is your ICD-10. We try to enter these, what the doctor sent over, when we get the referral in, but that they don't always have something. And sometimes you may want to change, obviously, what your ICD-10 diagnosis is. So you can click here at the top to view diagnosis to see what's already in there. If you like it, you can just stick with it. If you want to add to it, then you can add to it right here. This orange box will show up if you've done it and you've already put some charges in, which I have done, but you want to now change your ICD-10 diagnoses. Now what you're going to do is come down and click yes, update all pointers for existing charges. That way the charges have the appropriate ICD-10s attached to them. So let's say that we wanted to just, if you know your diagnosis code, you can just put it here. But if you want to search for something, let's say you've got right hip pain, I don't need to guide you through this. Hopefully you have a good working understanding of ICD-10 codes. If not, then we'll just have to talk about that another time. Add that selected diagnosis to the case, and now we've got right hip pain in here as well. So the changes are already saved. You can click out of this. That's all you have to do for ICD-10. The next thing you come over, you don't have to do anything for patient visits, appointments, charges, or activity log. Your goals, this has recently just updated. So essentially when you click in the notes, the first thing that's going to be there is your goals section. But you can just click on your goals section. I do because I'm accustomed to doing it this way. Okay, so now it brings this section up. What you're going to do here, none of these will actually be here. So let's delete these so that you can see what it's like when you first start. I should have showed you that step in a little bit. Okay, it doesn't want me to delete that goal. I can hide them though. So if you want to select all the goals and either delete or hide them, you can do that. Hopefully it will let me hide them. At any rate, what we're going to do here is to add your goals. Let's pretend there's nothing here already. To add your goals, you're going to come down and you have to select a goal category. Why that is, I don't know. But if you have some favorite goals that you want to save, you'll see that in that group action, I was able to add to my favorite goals. So I could add these and it will always just stay in there. If you use goals, the same goals a lot, just go ahead and start adding them to your favorite goals list. I should do that a little bit more because I do have a lot of goals that I use fairly repetitively, but for the most part, I have my favorite goals and I have patient will be independent. Okay, I select that one. In order to add it though, I have to actually add it here. Okay. Okay, that doesn't normally happen that way where it shows up as balance and vestibular goals. Usually, I'm not sure why in the test patient it's doing that. Formatting's a little bit different, but at any rate, it doesn't really matter much. Your goal is going to show up there, and that's all you really care about. You can add notes to the goal. You should add a time frame if, in particular, if you don't already have the time frame written specifically out in your goal. Let's say 2 weeks. This is a new goal. If you're in your progress note, you can update the status of it right here. If you want to add notes so that you're progressing, if it's a manual muscle test grade that's improved from 3+ to 4-, but it hasn't quite met your goal of 4+, whatever it might be, you can put it in there. Okay. If you want to include it in today's note, you select it here. Usually on this initial evaluation, all you have to do is go through all of your notes, go through all of your goals, add them all in, and then click include in today's notes. Once you do that, it's going to include all of these goals. So you do the same thing down. You can go into lower extremity goals. It has some that are pre-populated, able to stand. It's got a whole bunch here. You can select from them. I'll be honest, a lot of them are not great goals, but some of them are decent. We're at increase lower extremity strength to 4+, to improve ambulation tolerance in the community. That might be fine. So you've got 2 goals selected. I'm going to, again, add them. They'll show up down here. I need to come down, add my timeline, add my progress if it's a progress note. And that's all there is to it. So that's the goals section. That will automatically show up in your initial evaluation now. So the next step is to come over to the notes, right up here in the top left-hand corner. Okay. A few different things you have to do here. So we're doing an initial evaluation. All you're going to do is add your template. So now you get to pick what template you're going to add. When you first start, it comes up to library here. You just need to click over to templates. I wish it was the other way around, that their templates was the one that it auto-selected, but it isn't. So let's come down. Let's say we're doing a knee evaluation. Select the knee. Click add. Okay, this part is pretty straightforward now. So here you're going to see that you have, under each of these headers, you have things that you're going to fill out. You type your subjective in here, come down to comorbidities, if you want to add any there, pain level. Okay. We tried to make these formatted pretty simple and take a lot of the things out that we don't need. There certainly are still some categories that we might go back and reformat. Always up for suggestions on how to improve these eval forms to be as succinct as possible, but definitely still including what we need. Coming down through here, you'll notice that on each that in this subjective section, there are a lot of categories you might not be filling things in. When that's the case, if you're not going to use comorbidities and you don't want it to show up because it will show up exactly like it is here, you click on it. You can maybe click on some other categories that you don't want to show up because maybe you're not specifically selecting out of this medical history. Maybe you're going to just write surgical and medical history all together here. You can do a number of different things with this. Just click on them, come back up to the top. Once you're done with this section, click this X here. It will ask you, are you sure you don't want to delete these items? Click yes. And now you're going to be left with just the things that you did not have selected. Okay. When you do your outcome measure, if you click on, say you're doing a knee here, we're going to use the lower extremity. A nice thing is you just have to put the raw score in. So say the raw score is 34, their impairment then already gives it to you here. What I do, and you don't need to update it in this section, but it's nice because this section, this outcomes measure section, will stay here. You can just come up here, you can put in, 34 out of 80 equals, 57%. You don't have to do that much detail. You can put the raw score, you can put the impairment level, you can put nothing, because again, this outcomes measure is going to be at the end of your goals. But to me, I like to still have the outcome measure again in another place. That's all about the subjective. So we click through these. It's the same process with each one now. Okay, go through, add the things in. Maybe you don't like this. You can totally just delete everything that you don't want. Click X. For your observations, sometimes I'm just going to hit this at the top, select all. Sometimes I'm only doing these three things. I'm going to put my palpation, which isn't really under observation. Why it's under the knee one here, I don't know. We could change that. But palpation, other, I'm going to describe all my observation right here. I don't want to go through these boxes. Sometimes the boxes are nice, sometimes they're cumbersome. And this is what my objective section would be left with, or observation, I should say. Okay, sorry, phone call coming in. Again, click through, that's super self-explanatory, right? We get to the assessment and plan. Again, my plans are all of those items of different therapeutic exercise, neuromuscular re-ed, gait training. If there's something else specific or different, I have dry needling in here. If you're not going to do that, or if it's a case that would be contraindicated, please delete that section so that the doctor doesn't question why we might be doing dry needling on the 90-year-old with chronic heart failure and he's on a ton of blood thinners, things like that. That might kind of freak them out and think we don't know what we're doing. But I have it there because I always like to include it for those patients that I need that signature for. If you have other things, definitely write it in here. You can highlight it down here right next to the frequency and duration that you're going to be picking. 2 times per week for 8 weeks, whatever it is. If you need something else to be alerted to the doctor, then definitely make it known in here. Otherwise, you want to leave this plan. The rehab potential, you don't need the assessment. This is where you're going to just write your narrative assessment. You know how to write an assessment. I'm not going to go through even that. Goals section, again, is right here. You can see what you did earlier. Come up. The last thing that you need to do, and then I'll review all of the different bits that we have to click through, is the certification period. So you'll see the certification period right here. Remember, for Medicare clients, we're going to pick 90 days. That's what it defaults to. For all of your commercials, as of right now, we're going with 120 days. If you want to leave it at 90 days, that's totally fine. The only thing that's going to happen there is that we're going to do a progress note before we necessarily needed to, but sometimes that's a good thing too. Your certification has to be tied to a note. What you're going to do is you're going to tie it to the note that you're doing on that at that day. So here's our 6/5/25 evaluation. We pick update. Good. You notice that we have multiple,
Just let me know.
You notice here that we have multiple certifications, and this is what you're going to do. If I forget to do this in the progress note section, when you go to do a new, if you're seeing the alert up here that we have no certification, and this is showing red that there's no cert period, when you edit, these are all going to be here. Please don't delete them. Just add a new certification period. Even if you deleted it, it wouldn't be the end of the world, but because it's going to show up in the notes. But we still want to keep those all there so we can see the overall track of how long this person's been in here and keep a record of those certification periods that we have applied for. Here, I'm going to cancel. We already did this. Okay, so again, when we come over to the far left-hand corner, this is our flow sheet. This goes right back to that daily note. This is where it kind of started. We have time in, time out you need. You have ICD-10 codes you need, goals, notes, and flow sheet. I know it does feel like a lot, but once you get going, it becomes pretty intuitive in terms of what you need to go through. The last part, you'll lock the note, or just click ready to review if you're still being, if you're still in the credentialing period, in which case I will do these last two steps. So in reality, you could kind of stop this here, forget the rest of what I'm about to say and learn it later. But just as one more reminder of where we're going with this, ready to review if you're being credentialed, lock if you're fully credentialed, and then we're going to print notes. I wish this was titled a little bit differently to indicate to you that's where we fax from, but this is basically it. This is where we're going to fax from. When this comes up, okay, you want a referral signature. You want to make sure it's an initial evaluation. Sometimes it will populate it as the daily note, but here we're going to do it as the initial evaluation. Okay, everything else is okay to leave it as it is. You're going to send the fax. In hindsight, I probably could have done this as a separate video. You've got your referral source, should automatically be populated in here. If you want to also send it to the PCP, you click on that. Okay. The issue that we're going to have here is this is going to look right because we don't have a referral in there. I'm going to send the fax. It doesn't like it because I've got please enter referral name, fax, whatever. But what happens is after you hit fax, this just goes away. It asks you, do you want a follow-up? Include a follow-up. That follow-up is just an internal note, so you don't need to. Click cancel and it's faxed. The tricky thing there is you're left questioning, like, did that really fax? But it does, it goes through. And if you're ever questioning it, just do it again. It'll send them another fax, or we can look at a report to see which notes have actually gone out. So that's the end of the initial evaluation.